Alright, in today's video we'll be covering Hivamat and pain as well as wounds and range of motion. Before we get going too far, let's talk about what Hivamat is and what it does. Hivamat uses electrostatic fields to create deep oscillations in the tissues. Basically, a pulsating static electricity causes tissue activity. It doesn't hurt or feel uncomfortable, and it creates this kneading vibration effect, relaxing muscles, alleviating pain, reducing swelling, and restoring flexibility and blood supply. This video shows that all the tissues below the applicator are affected by this vibration, and every tissue that it comes in contact with actually has a benefit according to Hivamat. This is a video of a clinician applying Hivamat to a lateral ankle sprain. They put a contact between the toes and then use the applicator wand to create contact in that vibration sense. There's a secondary way to use Hivamat on patients. In this one, the clinician has a lead on her left forearm and then runs her hands over the body of a patient who's holding that other lead in that right arm. And they run that vinyl gloves over the tissue, and all of those tissues get the effect of Hivamat. All right, now that we know what Hivamat is, let's take a look at what it can do versus pain. I found 3 articles that deal with this topic. And the first one deals with fibromyalgia. In this study, they took 70 patients between the ages of 18 and 70 who were all diagnosed with fibromyalgia syndrome and did not have any contraindications to treatment with deep oscillation therapy. They treated the patients with a 45-minute treatment with unknown parameters for 2 weeks and a total of 10 sessions. Before the first session, they met with a physician who documented scores on a pain scale of 1 to 10, on a fibromyalgia symptom scale, as well as a short form health questionnaire that dealt with not only pain and symptoms, but also with mental health and well-being. After the 2 weeks of treatment, they went and had all the same tests done again, and then 2 months post-treatment, they had the same test a third time to see if the symptoms had diminished for a long period of time. At the end of the study, 63 patients completed the protocol, and they all rated it as a very tolerable treatment. At 1.8 out of 10, they said it was just super tolerable to have it done to them. After 2 weeks, their symptoms of fibromyalgia decreased by 19.3%, and 2 months post-treatment, they decreased by 18.8%. Their pain scores went down 30% after 2 weeks and were still down by 18.8% after 2 months, showing that not only was the treatment very tolerable, but it was effective in treating fibromyalgia. The strengths of the study really lie in the specificity of it. It measured if Hivamat works for fibromyalgia patients, and it seems to really work for them. They had a lot of different measures to show that it did, and they followed up 2 months post, which was awesome to see. Weaknesses were there's no control group, so it doesn't really show if a fibromyalgia patient would be improving over that course of time, though they don't seem to be improving that much. And its specificity goes for a really specific group of people, but not a wide range of uses for Hivamat. All right, and the second study covered the effects of deep oscillation therapy for individuals with lower leg pain. In this study, there were 32 participants between the ages of 18 and 30 who were all physically active. There were 13 males and 19 females. 16 of the patients experienced lower leg pain, and 16 had no lower leg pain and were used as a control group. The intervention was a 16-minute deep oscillation therapy using a 1-to-1 ratio at 70 to 80% dosage. Before the therapy was given, they tested ankle dorsiflexion range of motion as well as a pain scale of 1 to 10, and then they did the same measures post. Outcome measures did show that there was an increased range of motion in both populations, but not significant difference between the two, meaning that both the healthy subjects and those with lower leg pain increased range of motion, but not differing from each other. The pain scale for those that had pain prior did also decrease by a significant amount. This study was really strong as it showed that young, healthy individuals can improve the range of motion as well as decrease the pain in people with pain. Weaknesses were that the patients were not clinically diagnosed, so they just all said they had pain, but there was no diagnosis of how or why. And also, it was only young and healthy individuals, so it didn't show the effects on an older population or a population that was not healthy. And there was no long-term benefit analyzed. The third article we'll look at covers deep oscillation therapy, reducing swelling and pain in athletes with acute lateral ankle sprains. This paper covered 3 different studies that had been done. on athletes with lateral ankle sprains and if it was effective in those groups. The first group had one treatment done on them and used a 150 to 165 hertz on a 1-to-1 ratio for 20 minutes. The second group had 20 to 25 minutes of therapy done with no other parameters recorded, and the third group used 150 hertz with no other parameters recorded. The study found that in the one treatment that it had no significant decrease in pain or swelling compared to other forms of treatment. In the second group, where they had 5 treatments, it showed that there was no significant difference between that and traditional methods of pain and edema control. And finally, the treatment that did 6 weeks of treatment, there was a significant decrease in swelling and range of motion, as well as less pain than those in the control groups that only had traditional treatments. The strengths of this is it compared a lot of data up to the point of 2018, and it had a variety of treatment models that were studied. The weaknesses is all young, healthy patients, and so it doesn't really show, again, if it's good for older populations or not healthy individuals. All right, let's briefly summarize Hivamat and pain. It does appear that Hivamat can have an effect by decreasing pain and increasing range of motion in long-term treatments, and its tolerability in short term can really be a benefit, as it is as effective in the short term as other traditional forms of treatment. So now let's take a minute and look at wounds and range of motion. I found one good article on this topic. That research was on osteosynthesis, and what happened was 40 patients who had a recent osteosynthesis surgery, which is a surgery where they merge 2 bones that are displaced back together, and they were placed in a control group with 20 people in each group. The intervention group had deep oscillation therapy for 7 days at an unknown parameter, as well as traditional treatment. The control group had only the traditional treatment. At day 2 and day 7, a 10-point visual analog scale of pain was given to the patients to complete, and after 7 days, there was a difference in 0.85 points on the VAS in favor of the intervention group, meaning that there was less pain in the intervention group. Strengths of this study was that it was a really controlled setting, and weaknesses were that there was only one measure used, and they didn't investigate the wound itself, only the pain. So it seems like Hivamat can help with wound pain, but it is unknown if it can help with wound healing as of yet. More research needs to be done on this subject. Let's continue on to range of motion and Hivamat treatments. In this topic, I found one relative research article. It was on hamstring flexibility and range of motion using Hivamat. In this research, they took 29 healthy physical active adults and measured their hamstring flexibility prior to treatment, and then they gave them a 28-minute treatment using a Hivamat 200 on mobility-focused parameter settings. That was a preset. After treatment, there was an increase of 6.17 degrees for hip flexion because of the Hivamat treatment. The strengths were the specificity of measures. The way they measured hip flexibility was really accurate, and the participant population was well chosen to see a consistent outcome. The weakness was there was no control group, so maybe laying down for 28 minutes with someone lightly caressing your hamstring might increase range of motion by the same amount. And for a quick review, is Hivamat good with pain? Yes, it is. Can it help with wound healing? Yes, it can. Can it help with range of motion? Most definitely. In my practice, I do plan on using Hivamat if it's available to me. Hopefully it is. And finally, here are my resources. Have a great day.